provided by our bloggers or authors are of their opinion and are not intended to malign any religion, ethnic group, club, organization, company, municipality, individual, or anyone or anything.
He's a surgeon. He's a 100-ton boat captain. He's a lieutenant on Seaside Heights Beach Patrol in New Jersey. He's a member of the Coast Guard Auxiliary. He's Dr. Michael Kachmar. Need answers to your medical questions? We have them. Listen in to hear latest on medical topics related to all that and more.
Hello, everyone. This is Dr. Michael Kachmar. Welcome to our show today. I'm Dr. Michael Kachmar. I'm a board-certified reconstructive foot and ankle surgeon. Today's date is November the 15th, year of our Lord, 2025.
Yeah, we made it.
And welcome to our show today, Jeremy.
Sure thing.
Say hello, Jeremy.
Hey guys, how you doing? I'm your old pal Jeremy. How you doing?
Good. So this is a medical show. I'm a board-certified reconstructive foot and ankle surgeon, practicing for almost 40 years. I've been practicing in New Jersey. We have 2 offices on staff at multiple hospitals, and I do reconstructive foot and ankle surgery, as well as we take care of trauma and infections, diabetic infections, things of that nature. My hair looks a little funny here. So anyway, we do this show. We've been doing this show for now about 4 or 5 years, and we're on all the platforms. You can find us on Rumble if you want to go there, YouTube. We're all on
We've been at
Twitter,
this
Twitch.
this for nearly 8 years.
Yeah,
now,
we're on Facebook. Yeah. So today we're going to get right to it. We're going to have a show. Today our topic is heel pain. So Jersey Shore Foot and Leg Center has been in practice for almost 40 years. We just started and opened up a heel pain clinic dedicated to heel pain in adults and children. We see about 30 cases a week.
Do you really?
Of heel pain. And
now for other people who have heard different things, this is like the plantar fasciitis that we talk about, or you've heard about, and it like digs into the muscles in the heel, right?
Yeah, I'm going to explain. I'm going to go and give you a whole explanation of what it is.
Okay.
But I just want to set the premise. You got to move your cup there, Jeremy. I just want to give you the premise that this is our clinic. We're dedicating a big part of our practice to heel pain. And we have the state-of-the-art equipment, which we're going to talk about. Why go to us? Well, we have about a 99.9% success rate, non-surgical success rate, and we get most people, we get rid of the heel spur, sometimes instantaneously, or heel pain, I should say. Sometimes it takes many, maybe a month or two, but we do get them. I don't know what that click was, but anyway, so that's what we're talking about. So let's go to my iPad, Jeremy, please.
Sure thing.
And right now, and Jeremy, just check if we're streaming, please.
I did. Yeah,
okay.
I did.
So what we have is, let me just get rid of this. What we have is this is from the Cleveland Clinic, and this is heel pain. So I'm just going to describe heel pain, okay? And I can't answer. I can't believe she. Anyway, we have heel pain. So many conditions. This will include plantar fasciitis and Achilles tendonitis causes heel pain. Okay, a sore heel is a common foot and ankle issue. Rest, orthotics, stretching, ease pain over time. If you ignore and don't treat heel pain, you may develop chronic problems that require longer recovery. Heel pain rarely needs surgery, in my opinion, and I agree with that. If we have 100 people come with heel pain, maybe 1 or 2, maybe 1 needs surgery, but very unlikely. So what's heel pain? So we're going to go to the video as they speak here, and you can see this is a picture of the foot and ankle, and you can see the bones and the calcaneus, and you can see the Achilles tendon. Can you see it there, Jeremy?
Yeah, I see it clear.
And it's
for those of you who only listen to us on podcast, we go live on Saturdays. If you like our YouTube and you like our Facebook, you'll get notifications for when me and Mike go live, and you can see all the visuals that we're talking about.
Yeah, you should go. So what is heel pain? Heel pain is a very common foot and ankle disorder. Remember, it's foot and ankle. You might experience pain, soreness, or tenderness anywhere in your heel, but the most common areas are underneath or in the back of it. There may be different health conditions that could cause heel pain, including plantar fasciitis, Achilles tendonitis. I'll add to that. I've had people who had poor circulation. They were treated by multiple doctors. Thought it was heel pain, plantar fasciitis. It turned out they had a arterial clot in their artery. Had to send them to a vascular surgeon. We've seen tumors, infections in the bone. So you really, it could be other things. It could be referred pain from the back. So
don't leave it to chance.
No. God bless you.
You got to call somebody like Dr. Kachmar,
right,
because he's the man.
Right. So heel pain can make it difficult to walk and participate in daily activities. It's important to see your healthcare provider. Obviously, most heel pain improve without surgical treatment, but you need to have some treatment. And most of the time, when I see people, this is the most common symptom. They get up in the morning, first couple steps really hurts really bad, eases up by the end of the day, hurting again, or going from a sitting to a standing position really hurts. Yeah. And so, what causes heel pain?
At that point, it's like inflamed. So when you're walking on it, it'll definitely cause that pain to spike.
Yeah, well, in the morning, the first couple steps before you warm up, kind of thing. Mm-hmm. So what's some of the causes? Well, Achilles tendonitis. So some people, the back of the heel hurts them, and that's Achilles tendon issues. Okay, the torn tendon. It's inflamed. Tendonitis. It could be a bursitis. It could actually be a tear in the tendon. And the other thing is, in a younger person, it could be called Haglund's deformity, which is a bony abnormality of the back of the heel. We'll go into these things in other shows, but I just want to give a generalized overview today.
Sure, yeah.
The thing I see a lot in children is called Seaver's disease, which is a calcaneal apophysitis. So actually you have a growth plate in all your bones in your body, but in the heel, when it gets inflamed and painful, it's what do you call it? It's called Seaver syndrome. And you see this in children between 8 and 14 years of age. And so that's that. James, can you just check the streaming for me, please?
Sure,
I keep on hearing. Just want to make sure we're streaming.
It might be the cell phone being on. I don't know.
Just keep going up and down.
Yeah,
okay, good.
Good.
And just sorry about that. We're live right now.
Yeah.
And all our shows are live, by the way. So why is the bottom of my heel hurting? So, and again, this is all out of Cleveland Clinic. Bone bruise. Some people who run, they could develop a bone bruise, or you fall off a height. Mm-hmm. Also, a stress fracture. We see this in runners. They cause heel pain. They're running a lot of miles, and the bone starts to crack. Your typical what you call plantar fasciitis, which is inflammation of the banded tissue. It's hard to talk to people who don't have this on their, if you're not looking at YouTube or Rumble, but you see here there's a banded tissue that goes from the heel to the front of the foot, and that's called the plantar fascia, and that gets inflamed. Maybe we'll show a better picture of that in a minute. So you got a lot of things that could be going on. I'll add to that poor circulation is something that has to be ruled out. Radiculopathy, which means pain from the back. Some people have infections in there. What causes? There's a lot of reasons for it. Yeah, well, the spurs is when you see the heel spur. That's the end stages of a really bad plantar fasciitis. That's recurrent plantar fasciitis over time. So how do we diagnose it? Well, we do a physical examination, which is very, very important. I could tell. I make sure to rule out other things. I can see what tendons are hurting you. I can see your circulation. It's all by a physical examination, believe it or not. X-rays are very important. It could be arthritis that's causing this. Could be a bone, tumor, benign bone tumor, bone misalignment, joint damage. If you don't get better, then we get an MRI. We do ultrasound in the office quite a bit, but an MRI would be at the end stage if you're not getting better. So how do you get rid of it? How do you get rid of? Oops, sorry, Jimmy. How do you get rid of the heel pain? Well, we give anti-inflammatories. If people can't take anti-inflammatories, we have one of our last show, we talked about medical foods. We have really good products for chronic inflammation that won't affect your stomach or your heart. Very safe. Stretching exercises, we could show you about that. Taping, some of the therapists do that. Physical therapy, we do the physical therapy in our office now. We'll talk about that. Orthotic devices, these are very important. I don't like the over-the-counter ones, but we make specialized inserts. Most insurances cover that. And that's amazing. The gold standard, as far as I'm concerned, is orthotics, which are inserts in the shoe, and injections, or injections.
So that may be those orthotics. They may be all you need for some people.
A lot of times, injections is the goal. First injection, and then it depends on how many injections. You could have up to 3 or 4, but usually an injection and a orthotic cure it right off the bat.
Does wonders.
Yeah, we have. I do very good technique. I use an injection technique that is almost painless. And I don't know what we're hear that beeping. So.
Put the phone sound all the way down on the board.
Oh, that might be it. Let me see.
All right.
Oh, let's try that. Yeah. Sorry about that, Jeremy. And so what are the complications? This is interesting. I didn't even think about this, but it says what are complications to heel pain, depression. Well, if you have your heel hurt all the time, you get down the dumps.
And pain has negative affect.
Right.
Has is directly correlated with pain. So
right. So when do you call the doctor? This is just kind of stuff. Pain that doesn't improve in a few weeks with rest, you should definitely come in and see us. Yeah. Pain that makes walking or movement difficulty.
Honestly, from me, I don't know about doctors, but from me, if I got that pain for less than a couple of weeks, if it's like 2 weeks or a week and a half, I'm going to see a doctor.
Yeah, put me back up. Yeah. Well, so the so just so you know, we see a lot of it. So heel pain, there's a lot of different reasons for it. Most of the time, though, it's an overuse injury. People say, well, why does it cause, what causes this? And I see it all different kind of people. Tall, short, heavy, skinny, it really doesn't matter. It really causes them to have a lot of problems. And I see them being treated, and they'll come to me sometimes. They've been treated for months and months and not getting better. That shouldn't be the case. So what we do is we examine you, we get a diagnosis, and then we set up a treatment protocol. And so the treatment protocol, there's a lot of things you could do with a treatment protocol. One of the things we do is injections. Now, when I tell you about an injection, we do and people are like, oh my God, injection. We use special needles, and I'm not kidding around. Just Dr. Jasper does the same thing. We're very gentle. We pre-spray the area. Most people, they don't even feel it. They I mean, sometimes it
because these are like very thin needles.
Very thin, like
this is like acupuncture.
We use we use a very thin acupuncture needle. It's very, very similar.
Now I use a needle that's similar with my Ozempic.
Right.
And Maggie will put it in me, and I'll be like, "Did you do it?" And she's like, "Yeah, I did it." So you're not feeling anything with those type of needles.
And we give we use the top grade. We use the best injectable that there is. We use the best. We put a steroid in there, which is called Kenalog, which is top of the line, most expensive steroid money could buy. We don't cheap out on that. And we put 2 anesthetics: a short anesthetic, short-acting anesthetic, and a long-acting anesthetic. And what that does is, before you walk out of the office, you feel complete relief because the anesthetic hits in. And that lasts for about 20 minutes, but then the other anesthetic I put in there lasts for 6 to 8 hours. By that time, the steroid kicks in. Right. And that could give you permanent relief or up to 4 weeks relief. Usually what we do is when you come in, we'll examine you, we'll get a diagnosis. We'll make sure the circulation is good. We'll make sure that there's nothing else going on. If we're suspecting that there's some kind of rheumatological disorders like Lyme's disease or rheumatoid, we'll do blood work. But let's just say it looks like a straightforward plantar fasciitis, maybe with a large heel spur. We'll give you the injection. We'll put you on some anti-inflammatories. We have a thing called a plantar fascial kit. And it's a very inexpensive kit. It's got a sleeve, and you can start doing your physical therapy at home, stretching. It's got a little ball, and it gives you a little thing to do at home. Right off the bat, that knocks out most of the people. They feel great after that. If you're still having pain and difficulty, and we then start the physical therapy modality. Now, we don't just send you right off to the physical therapist. The ones I send for physical therapy, a lot of times are the ones who, before we talk about surgery, which are very, very rare. And I don't know why it keeps going like that. I don't know what it is.
Yeah, maybe.
And we got. You know what it is? We're getting comments, Jeremy. That's what it is with Facebook. I don't know why it's not coming up. That's what it is. You're getting hits there. Sorry about that. Yeah, not coming up. So what we do in the office is we have with this clinic now, we're incorporating some new physical therapy things. One of the things I want to talk about is this is new technology. I've been watching it, and this is called LED, infrared, and red light therapy. And can you go back to my screen, Jeremy?
Sure thing. Yeah.
Yeah. So this is what we have in the office now. This is very, very powerful. So this is the unit. It's called it's a company who sells this is Hills, a very family-owned operation in Pennsylvania. So this is called the Horizon 2 LED infrared and red light therapy unit. It's lightweight. So here's the thing. It's 80 MWs of infrared. That's 880 nm, and red 600 nm light. 36 infrared super luminous diodes, and 7 visible red super diodes. So it's pretty heavy duty. So this is how it works. It promotes cell level drug-free healing. So studies show that light emitting diodes, which is LEDs, like these designed into this light therapy, stimulate the basic energy process in the mitochondrial, which is energy compartments of each cell. Evidence indicates that cell absorption protons and transform their energy into, this is called ATP, the form of energy that cells utilize. The resulting ATP powers metabolic process and synthesizes DNA, RNA, proteins, enzymes, and other products needed to repair or regenerate cell components. In short, light therapy facilitates and stimulates healing process.
Yeah, now this red LED stuff is no joke, folks. I've seen it do wonders for numerous things, but this is hot right now.
So this is what we're and it's FDA cleared. There's some specs here, and it can only be given by a physician. This is physician given. We'll do this in the office if you still have issues. The other thing we do, you could go back to me, Jeremy.
Sure thing.
The other thing we could do is ultrasound. You just get ultrasound, and there's a lot of ultrasound therapies out there. Let me just, I'm going to go here. I'll show you what the ultrasound units. There's different ultrasounds out there, but there's the ultrasound. You've heard of ultrasound, right?
Sure.
I don't know if you.
Yeah, I've heard of it.
There's different kind of ultrasounds where you could put it on the area, but ultrasound is very good. So we
that sound was just people liking our video.
Yeah. We're on YouTube. So
for those of you who are watching us, we go back and forth on the screen here, but today we're trying to we want to generate some phone calls if we possibly can. For any of you listening to us live, okay. You want to call 732-237-4949. The number is 732-237-4949, and you can join us on our show. If you're not watching us live, go to Facebook or YouTube or any of them and like them and subscribe, and you'll get notifications for when we do go live. And you can ask Dr. Kachmar all the questions you need about your foot pain and your heel pain.
Are you sure, Jeremy?
I'm pretty darn sure. If everything's working nicely.
So don't put me. So I'm gonna. So the ultrasound stuff that we talk about too. So we're getting. We're having ultrasound equipment in the office too. We've used ultrasound for many years. And I just want to show you what some of these units look like. People don't know what they look like. They're like, well, what does ultrasound look like? So I just want to show you what the machine looks like. And we have this in the office. So, Jeremy, can you go to So these what they look like, and they have different probes. And this is just one unit. This is a very, very good product here. And these devices, again, they help to increase healing. And these are very, very good units, and we have that. So what we do in the office, we'll do the ultrasound. This helps with tendinitis. You can go back to me, Jeremy. This is for the Achilles tendinitis. See, a lot of physical therapy places don't want to do ultrasound anymore. Because it's just their model is different now. A lot of places don't use it. You could request it, but we do it. We do it in the office, and I actually do it myself to the patient. It's done properly by a doctor, and that works amazing. You got to be careful with it, but it does help. So we do ultrasound. I don't think a lot of physical therapy places don't do it anymore because it really doesn't pay them that much, and
that's
it's time
really the bottom line, right?
Well, but it for specific. Listen, they do great post-op, and but there's a lot of times where you need ultrasound. The other thing is the infrared. Again, that's another hot, very specific for this disease, right?
Very hot right now.
The other thing that we can use is high voltage stim. The problem is you have to be careful with high voltage stim, especially if you have epilepsy or even a pacemaker. So I tend to stay away from that.
Right.
It zizzles your, So
yeah. You don't want to get a gazizzle.
No, I've been pretty good. I think these modalities work really well. I've been using them for many years. The ultrasound is very good, and the
and guys, he's got to pay for this instrument. Okay, if you've known doctors and surgeons as long as I have, they're not spending money on stuff that don't work. Okay.
No.
This is hot. They know it. They know it helps their patients, and that's what they're all about.
Right.
Yeah.
And you don't have, and not that a PA is a nurse or whatever, but you got the doctor doing it. We do our own stuff. Just like Dr. Jasper, just
hands
like
on,
Dr.
man.
Right.
So you always said one of the best quotes I think you've ever done is nobody touches their patients anymore, and you got to touch them to know what's wrong with them. That's it.
Yeah. I'll tell you some anecdotal stories about heel pain because we see it. So I had one patient come in. He's referred to me by a family member. He was seeing an orthopedic group who has a foot and ankle specialist. So they initially saw the orthopods because they thought he had a spinal injury or spinal disease, like with Dr. Gable Jasper. And I think they gave him 1 or 2 injections in his back because they got an MRI. It looked like he had a herniated disc or something like that. And they thinking it was referred pain down to the heel.
And those type of injections, for those of you, they're more diagnostic than they are to make you feel good. If they do make you feel good, that's a plus. But a lot of these injections are diagnostic to see exactly where your pain is and how they can, where to start.
Right. So that didn't work on this patient. And so they kicked the patient over to the foot and ankle specialist.
Gotcha.
For heel pain. So he or she did X-rays. I think there might have been a spur, and they tried some cortisone injections, which didn't help. Okay, and then they ordered an MRI. And the MRI was kind of like quiet. Really didn't say much. A little bit of spur, a little information, but that's it. And I don't know if they did anything else for the guy, but he was not getting better. He was getting worse. So they came to me for a second opinion, which, again, we talk about second opinions, third opinions.
They're important.
If somebody was seeing me and you're not happy or you're not getting better and you want a second opinion, if they ever ask, I say, go. But anyway, he came in. And I made the diagnosis in about 30 seconds. And not that I'm so great, but what do? I examine the patient. First thing I do is I check for circulation. The guy I couldn't feel his pulses with my hands. So in the office, we actually have a Doppler. It's a very sophisticated piece of machinery. Again, it's another $5,000-$6,000 piece of equipment that a lot of doctors don't have.
But you're not going to spend the money on something that don't work.
Right. Yeah. Well, this thing here, I could instantaneously tell you if you have poor circulation or not.
Right.
Quickly with this machine, and it tells me if there's blood flow. He had no blood flow. It was very decreased significantly. So right there, we stopped. I said to him, listen, I'm going to send you to a vascular specialist. And he went to the vascular specialist, and they probably within the next day or two put him into the cath lab, and he had put stents. They put stents in his leg. He had a blockage in his arteries in his leg. So that's what was going on there. So the heel pain was not plantar fasciitis. It was actually ischemic pain from a clogged artery, almost like having a heart attack, but in your leg. So that's what was going on. So that's one case. And anybody says, "Oh, that's bullshit," I could document it.
But it's a perfect example of not taking anything for granted.
No,
like if you got heel pain, like with anything else, man, don't keep it to yourself.
No.
And also, I just want to add real quick, Mike, if your heel is hurting you and it's so bad and it's right through the roof, and you go to an emergency room, you can ask for Dr. Michael Kachmar if you're local. He is affiliated with most of the hospitals around here, and just say, listen, I want Dr. Michael Kachmar. I heard about him. He's the only guy I'm going to trust right now. I want to see Dr. Michael Kachmar. You're not going to make a mistake. I'm going to send my kid when he comes back from college to go see Mike. So that if that's not a testimony, I don't know what is. If he's amazing enough to send your kid to, send yours.
Right.
Yeah.
And what I want to also illustrate to you is that not every doctor is going to be able to diagnose what I did. And because, we specialize in heel pain, can you imagine that patient would have been a lot better and would have had his diagnosis a lot sooner if he went to me instead of those people.
Right.
And I'm just saying this, if you have heel pain, why don't you go to the place that specializes in heel pain?
Right.
We specialize in it. We've been doing it for 40 years. Our heel pain clinic has evolved into the state-of-the-art heel pain clinic. I think we have a heel pain clinic that surpasses. So that's my point. That's my opinion. But let me just give you another another, what do you call it, illustration. I had with heel pain in a child now. Okay, this is heel pain in a child, and I got called in to the hospital. There was a child, maybe 4 years old, and maybe 5, and they had heel pain, believe it or not, and the patient was in the pediatric department. And they were going to ship the kid out to Philadelphia, but the grandfather insisted that they have see me first because he had a lot of faith in me. I operated on him. He was a Navy SEAL during Vietnam, Special Forces guy. He's passed away now, but he was an unbelievable guy. I actually did lateral ankle stabilization surgery on him, and he was an underwater diver. Navy SEAL guys. Anyway, the child he had. They did an MRI, and it looked like he had an abscess in the heel. It looked like there was something in the heel. Huh. So I told the parents, I said, listen, I'm going to take him to the operating room, and we got to drain this. I got to see what it is. I got to get a biopsy. So, you're talking about a little foot about this big, So I took him into the operating room, and we have good anesthesiologists who could deal with children, thank God. And we also had infectious disease doctors who specialize in pediatrics. So I made a small incision, and there was this fluid in there, pus, and I drained it, cleaned it out, packed it, and we took cultures. And about a day or two later, the infectious disease doctor called me up, and she's a pioneer. Her name is Isabel Guerrero. She actually was one of the pioneers in diagnosing Legionnaire's disease. Oh, wow. Yeah. And she was a physician at Community Hospital, a brilliant woman. She probably forgot more than most infectious disease doctors even know. Yeah. And she called me up and says, Mike, she goes, do you know this child has salmonella? Salmonella. I'm like, really? Now, salmonella, you hear about salmonella poisoning, and So what actually happened is an interesting case, is that the grandfather got the child a pet turtle in the summertime. Now, you're not allowed in New Jersey to sell or give pet turtles. Turtles carry salmonella. Yeah. So the kid was playing with it, probably got it in his mouth, his ears and nose, whatever, eyes, He got sick. Now, they thought he just had a flu during the summer. So the pediatrician didn't put him on antibiotics, just thought it was a summertime cold. And then they forgot about it. Well, what happened is that salmonella went through his body, and in a young person, it could settle into the growth plates in the bone, and that's what happened. And that's where it was. So it was what's called hematogenous. Hematogenous means brought through and produced by and transmitted by the bloodstream. Hematogenous osteomyelitis. Osteomyelitis means a bone infection in a bone. Osteomyelitis. And that's what he had. It was a very interesting case. We had him on antibiotics, and, he got cured.
I had, when I was 4 years old, I had a really bad case of salmonella poisoning.
Oh, you did?
Oh, yeah. I was in I was cordoned off in a bubble.
Oh, really? Okay, so you know.
Yeah, beyond the bubble, my parents could only come in face, head to toe, covered in
did they
masks, everything.
Did they know where you got it from? Did they?
No. We had speculations like we thought it might have been White Castle at one point, the one in Rahway, but right next to the prison, if it's still there. Or we thought it was like my mother made some jam, but I don't know.
Well, you could. Well, here's where you get a lot of times people get salmonella nowadays is from raw chicken. So say you're going to cut chicken. Say you're working there in your kitchen and you get a chicken. You're cutting it up. It's raw. Like you're going to cook it. So you're cutting it with the knife, and then you leave the knife on the counter. You put the chicken in the stove, and then your wife comes along, and she's just got a nice big Italian bread, and she takes that knife and cuts the Italian bread. Well, now that could be contaminated with salmonella. So at night you're having the chicken, you're slopping on the butter on the bread, and you're putting it down. Now you got salmonella poisoning. Right, a lot of people die from salmonella poisoning every year.
And you know what? When I was a kid, all kids they'll find a pet. Maybe it's a frog, maybe it's a turtle.
Right. You gotta be careful.
We had a pet turtle. My friend and I. That we called Frankenstein. No, Rocky, we called him. And we didn't know. We were kids. We're holding them up to our mouth. Right. We're doing all, right. We're not washing our hands after touching them and stuff like that. So it could have been from that. Right. It could have been from that.
So anyway, why come to me? Because I have a lot of experience. Go back to the, I just want to give you a few more other causes of heel pain, because people think it's just a plantar fasciitis. A lot of podiatrists, a lot of orthopedic surgeons, a lot of primary doctors don't know the difference. They think, it's just heel pain, it's a plantar fasciitis. Well, here's some other things. Here's other possible causes of heel pain. Now, this is right out of let me see what this is. AM, this is American
APMA.
Which is American Board of Podiatric Medicine. These are pretty heavy in surgery. So, what are other causes? We always talk about this. Rheumatoid arthritis and other forms of arthritis, including gout, which usually manifests itself in the big toe joint, but it could be in the heel, it could be in the Achilles tendon. Gout not only affects joints, but tendon sheets. People don't understand that. Tendon sheets are actually the same physiologically. It's almost like a joint. You got fluid in there, and so you could get gout. And I know, because when I operate on people and I am cutting, I can see the gouty tophi in the tendons. Huh. You got inflammatory bursitis. This is a small sac. Another thing is a nerve growth. You could have a nerve tumor in your ankle that could cause heel pain. In fact, even if it's not a nerve tumor, you could have inflammation of nerve. It's called Baxter's syndrome. And that's where you get more pain lateral outside of your foot. And if you know what you're dealing with, when you give the cortisone injection or the light therapy, you want to hit that nerve specifically. It's a small nerve, and that really is, what some people come into me, they've been treated by another doctor, and what they have is really Baxter's nerve impingement or neuritis. And you could actually operate on those, but I tell you what, if you know what you're doing, you could get rid of that pain, usually with injections, specified, targeted injections. We use ultrasound guided sometimes, and the other modalities. This red infrared is like amazing stuff, and ultrasound. Yeah. We calm the nerve down, and usually we could do it without surgery. But you gotta know the diagnosis. I guarantee you. If you're being treated about your heel pain right now and you're not getting better, go in there and ask your doctor, say, hey, do you think it could be Baxter's neuritis or Baxter's syndrome? They'll be like, what are you talking about? Yeah. Another thing that we see is Haglund's deformity. This is usually in a younger person. It's called a pump bump. And it's an enlargement of the back of the heel. It's a congenital thing. Again, I've seen so many people have surgery on this. I think it's unnecessary to have surgery on it. You could usually treat it symptomatically with orthotics. I've seen people, have the bone removed and have certain complications. The other thing where you could get surgery is where you have an Achilles tendonitis or Achilles spur. There's a spur in the back of the heel, and sometimes that's really bad. There's tears there. And also Achilles tendonitis, that's where the tendon is partially torn. And again, I would ultrasound it, heavy duty. I would do the ultrasound, the red therapy. Yeah. And then ultimately on those, if it doesn't come around, what we do is we actually operate on it. We make an incision. We debride the tendon. That's the last resort. But I tell you what, with the new technology we're getting, we're less and less operating. I mean, I think that probably 25 years ago, if 100 people came in my office, about 85% we cure, 15% we operate on.
Yeah.
Right? That's for plantar fasciitis heel spur. You know what it is now? Maybe 1% that we operate on. Achilles tendonitis, again, that used to be, man, back in the day, 30% operative. Now we got that down to, to, again, maybe 5%. And I think with the technology we're getting, especially in our heel pain clinic, get that down to maybe 1 or 0.
Yeah.
So below 1%. That's our goal. You could get out of here for me, Jeremy.
Sure.
But I think that what time we have, Jeremy? Let's see how long we've been. Okay, 35 minutes. Good. So I think that we're going to be talking about this more and more as we develop the clinic. We're going to do some advertisement. If people want to call up, if you have, now that we have a phone set up here now, we could take phone calls. So if anybody wants to call us during a show, anytime, anywhere in the country, by the way, we had, this is on Spotify, this is on podcast. If you hear this, give us a call. So the number is 732-237-4949. Again, let me repeat that. 732-237-4949. You could give us a call, and we could give you some advice. Obviously, we don't like giving, we can't, we could give you general advice, but if you have any heel pain questions, you give us a call. I've been doing it for 45 years. And the differential diagnosis is the key here. And so when you're a doctor, right, and you come into the office, Jeremy, you say, I got heel pain, and I'm going to examine you. In my mind starts going, well, what is this? So I'm going to have a diagnosis, and then I'm going to have a differential diagnosis. Now, what does differential mean? Well, that means what else could it be? So it could be plantar fasciitis heel spur syndrome / or it could be poor circulation, or it could be arthritis, or it could be a bone tumor, or it could be a stress fracture.
You're listing the possibilities of what by what you've seen, what it could be.
Right. Yeah. And I've seen just about everything. And your primary doctor is not going to have that knowledge most likely.
No, I wouldn't
now,
so.
Here's the thing too about podiatry. And again, I'm not criticizing anybody, but when you go to a foot and ankle specialist, right?
Yeah.
It's amazing to me. People don't look at their credentials. I'm board certified in not only foot surgery, but I'm board certified in reconstructive foot and ankle surgery. Okay? That's only about 20% of us are certified in that. There's a lot of doctors out there who don't get certified because they can't. They don't have the cases. They don't put the time in. They don't have the training.
Yeah.
Now, I'm not saying I'm better than them. Okay? But
No,
I have
but
better.
I would
But I
say-
have better credentials.
Yeah,
Now,
I would say that if somebody had something like an accident, something traumatic, and it happened to their feet, and they are scrambling to find a professional that can make this foot something that they can actually use in the future. Well, I mean, come on. You got to find a guy like Dr. Michael Kachmar at JerseyShoreFootandLegCenter.com. He's the guy. He's the super specialist. That's why we have a show like this, because we need to let people know about him.
Well, I think that's very true, and I think that what people have to understand is that I have the credentials. A lot of people don't. So hang on, Joe. I know what you're saying. What I think you should do. I'm just trying to do something here. I think you guys should do is see what your doctor's credentials are.
Yeah.
And before you go, if you're not getting better, it might be because you're dealing with somebody who doesn't have the expertise. I'm just saying is this: when you go to a doctor, I don't care who they are, look at their credentials. It's everything. Like, you look at my webpage.
Yeah.
You go to my webpage. It's comprehensive.
You're going to find out about
and
who
you shouldn't
are,
have to
what
search.
You're capable of.
I go look up. I have patients come in and they say, "Oh, I'm seeing Dr. Jeremy," And so we look them up. We want to see, well, who are they seeing, And you know what? I look at first of all, a lot of doctors don't even have a webpage. And they got some bullshit thing there. And there's nothing about their credentials, which makes me wonder, why aren't you, it should be very easy. You go to my webpage. Everything is there. Everything is there. So you want to grab this here?
Is that a call?
Yeah. Yes.
Oh, yeah.
hang
Great.
on.
Just press the center button.
Hello.
Is this Dr. Barbara Snyder's?
Hello.
Oh, you're looking for Dr. Barbara Schneider?
She's not. She's. Go ahead. Go ahead.
No, I know that, but I'm just watching it on the computer, and it said call that number. Maybe I'm too late because it goes on in the morning.
Yeah. I did that show. That was me you're watching. Yeah,
Oh,
we're a
too
big
bad.
family here. This is our family show. Right now, we're doing Scrubbing Up with Dr. Michael Kachmar, but which is like politics and health as well. So, but yeah, but I want to thank you for listening. Yeah.
Thank you for calling
Yeah,
in.
but I would have loved to tell my story because what she did for me and my wife is unbelievable.
Well, she's a great surgeon. I've known
Yeah.
Barbara. I've known Dr. Snyder for 30 years, and she's a great person. And we'll
Yeah.
put, what's your name? We'll tell her you called. What's your name? You want to give your name out?
The patient was Debbie Dean,
Debbie Dean.
and I'm Phil Dean, the husband. She knows me because I always go in with her.
Okay.
We'll pass the message on for you, and thank you for
Yeah,
listening.
tell her, we're praying for her because
Yes.
we
Thanks
love
so
her.
much, man. Thank you so much. I'll make sure she gets that message. Debbie
Thank-
Dean.
Okay, thank
Okay.
you.
Okay, thank
Thank
you.
you.
Take
Okay,
care.
bye bye.
Bye-bye.
Bye bye.
So
So
we got a lot of people who watch our shows, not just Barbara's, but Mike's and Dr. Jasper's, and you know, I mean, there's a lot of love out there, and we
Right,
thank you
right, right.
all
Well,
for your attention.
yeah, we didn't really do a lot of call-ins because I felt that it interrupts the show. But now we're seeing that so many people want to call up, and it's that intimacy that I think is good.
Yes.
So I have no problems with that. What we're going to do is probably. We'd probably start the segment in the first 15 minutes. We'll talk about content, and then after that, we'll have a call-in section. But we'd love to I would love to have people call. I mean, this reaches all around the world.
Sure.
So you guys could call, and that's why we have the number here, and it's available. So again,
If you've got that pain that we've been discussing about this show in your heel, maybe it's slight. Maybe you're just wondering what the heck this is. You can call in, and Dr. Kachmar can either put you at ease, or he can tell you exactly what you need to do. Well, you go to him, and he'll fix you.
right. So Jeremy, let's go to the videotape, as they say.
Yeah,
I want
let's
to show
do
you a little
that.
bit. So here's a nice picture
Oh, wow, yeah.
of the heel pain. So I'm going to zoom this up. But if you can see the people who are listening, it's a picture of the foot, and there's heel. You can see the heel spur, the arrow's going to it. You can see the inflammation. See that, Jeremy?
Yeah, I see.
And that banded tissue is called the plantar fascia. Okay, is that pretty obvious?
Yeah.
And, so we're going to zoom up here a little bit, and let me see if I can get this here. Hang on a second. It's not going up for me. There we go. Let me get it up a little bit here. This is a little bit difficult to manipulate here for some reason. Just give me another. So anyway, we're having technical difficulties. Sorry, everyone.
Right.
So I'm trying to get the heel here. Anyway, where are we at here? Here it is, right there.
There you go.
Yeah, but it's not doing what I want it to do. So anyway, we can't. So there it is, right there.
There it is.
So there you have your a really good picture of this. And if people want to go to our Rumble or Facebook, or actually we're on X or YouTube, you could see this in real life.
Twitch.
Yeah, right. And this is what's demonstrated here. So what we do is where that heel spur is. Now, people say, well, how am I going to get rid of the heel spur? Because if we don't get rid of the heel spur, I'll have pain forever and ever. And that's not the case. 99.9% of people, we take care of them with no surgery, nothing. The spur is still there, but there's no more pain.
Yeah.
Together with orthotics, which are inserts that go in your shoe, or injections, our physical therapy, our ultrasound, our dedicated pulse ultrasound, special ultrasound that increases the blood flow. Also, our infrared light. All of these things, and also we have medical food that is natural, doesn't upset your stomach. We cure these things now.
So increasing the blood flow brings in healthy platelets to help heal that inflammation.
Right. You go back to
That's great.
Now the other thing is too, there is actually a thing called shock therapy. And you could actually, that's a little bit more invasive. And instead of having the surgery, you could hit the shock therapy. But what's the matter? Too loud?
No, I just gave myself shock therapy.
Oh, okay. And so what about? Let's just. I don't want go too crazy, but so people say, well, what if, you need surgery? I've been doing surgery on the heel for many, many years. I haven't done surgery now for a while because I just had surgery on my shoulders, so I haven't been operating. But we did a procedure where we make a small incision, we take the spur out, we cut some of the plantar fascia. It takes me about 30 minutes to do. You're in a cast for 2 weeks, and then you start hobbling around. I've done probably, at least 1,000 of them, and they're very successful. There's also minimal incision surgery where you go in and just cut the band of tissue. There's also shock therapy. So the shock therapy is the same technology where they what do you call it? They knock your gallbladder, your kidney stones. You ever hear that, Jeremy? Where they do the kidney stone thing?
No.
I don't know if you ever heard about that.
No,
you never heard that? It's called shock therapy. I know it sounds crazy, like you.
And it shatters the kidney stone, does it?
Or? Yeah. Let me just show you. Let me see if I can find it here. So you keep talking. So it shatters.
Yeah.
It shatters the. It shatters the
stone.
The stone, actually. So the thing is called shock therapy. You could buy them. Let me see if I could find it for you. And let me just get the Superstore here. Let me see if I can find it. Just show you what it looks like, real quick.
Yeah, of course.
So it's an apparatus that let me see here. It didn't go to where I wanted to go. And you could here. What is it? Come on. Here it is. Here.
Shocking the
new equipment here. Let me see if I can see here. Shock therapy right here. Sorry for that. I just want to show you. So shock therapy unit.
You want it?
Hang on a second. Not yet. Let me just go here.
Okay.
Let me see here.
Live show, folks.
Yeah. So get put up here. So this is a shock therapy unit. So it says new radical, but it's really not. It's a maybe this unit has been developed with a clear focus on maximum ease. So what it does. It sends a shock wave into the heel and breaks up the scar tissue, and even outside the therapist's office. Sometimes you have to use anesthesia with this, and but it's interesting. This is what it looks like here. So I'm just going to read it here. So kinetic energy induced into the target area inside the patient's body and composed of air-powered projectile strikes anyway, it goes on and on, transmitter. But what it basically does is it sends, here's a good picture of it right here, people want to look at it. It sends this shock wave into the body,
right? Okay?
And, you could read this here. It's the whole thing. People should go on here and look at this. And this is really good for tendinopathy, heel and shoulder pain, trigger points. It's a pretty good thing. And here's the indications: calcification, plantar fasciitis, patellar tendonitis. There's a lot of stress syndrome.
Terms, yeah.
You could use this on a lot of different things. See
trigger
it here?
Points for countless areas.
Right. So before you have surgery, if you fail everything else, we would probably introduce you this, and this is shock therapy, and it's pretty good stuff. And they used to have one that was so, they just like everything else when they start having it. So the first models, you had to have anesthesia.
Mm.
You need anesthesia. It hurts so much.
Yeah.
Now these units are they keyed them down a little bit. They work just as well.
It's like it shocks, but it's air. It's
what it does, it's breaking down scar tissue.
Yeah.
And here, right here, it says newly developed piece, excellent dampening during pressure wave generation, reduces handpiece vibration. As a result, this is called the Master Plus, is approved for operation far longer than a working day, longer than many other, because it's a lot of work on the patient, but on the individual. But it's not that tough. It really works well. And
I think the name shock is what would scare a normal person, but from the look of it, it doesn't look painful at all.
No. The old systems used to be, and now you could do it without putting anesthetic in there. I just want to give you. This is a great product, and
go back down. I want to see because they're pushing it against the heel down there.
Yeah,
there's a picture.
yeah. There's a picture right there of the heel.
Yeah, right there.
Yeah. Now this is for people who don't get better. These are the bad cases. So before you have surgery, you come in for this procedure. So here's the thing.
Can you zoom in on that? I want everybody to see that clearly. Yeah, look.
Yeah.
That's great, man.
So now you're talking about, and sometimes you want to numb these up, but here's the thing. You're talking about having surgery. You're going into the hospital. You could put me back in. You're talking about anesthesia.
Yeah.
And surgery. I mean, when you talk about a hospital stay, I mean, you're talking $5,000, $6,000, $7,000. I don't know what they're going to charge insurance, but still, it's inconvenience. It's time out of your life. You got to have an incision. There could be a chance of infection. This technology now is why we don't do as much surgery as we used to. We're getting into the age of Star Trek, where you take the tricorder and go, "Wurr." Well, that's what we're doing here.
Fantastic.
No, I mean, yeah. I mean, but again, these things, this thing here, it's probably, I don't know what it cost, but all of these things cost us a lot of money. And you say, why don't the doctors have it? Because this unit here probably cost about $15,000. But, how many, you think your primary doctor is going to have it or the PT places? So we're investing in a lot of equipment we've had over the years. We always have the best x-rays. We use the best steroid. We use the best equipment. Everything is top of the line. I never, ever chintz on that. And I know that Dr. Jasper, pain management, Dr. Toro, we're all the same. We're on the cutting edge of medicine. And, even though we're older.
And you're bringing the best versions of these cutting edge procedures to your patients.
Right. But we also are not, you're not going to sell me the Brooklyn Bridge or a piece of land on the moon.
You're not a schmuck.
We're not going to just grab everything that comes out and run like chickens without heads on. We look at the stuff, we wait a while, we research it.
Read the case studies.
Right.
That,
we're not taking every new thing and just saying, oh, this is going to work.
But when you find something and you see that it works, you want to bring that to your patients ASAP.
Right. We don't want to experiment on anything. But so we have, our heel pain clinic, we've upped the game now, and we're up in the game for several reasons. And one reason is that the technology now has taken such a giant leap with AI, and the equipment now is actually more easy to use. It's more patient friendly. It has less side effects, or maybe none. Okay, and it's supplanting. It's reducing the amount of patients that need to be brought to the operating room. Just like Dr. Jasper, not everybody, needs to have an open surgical fusion.
Big open back surgery. Yeah.
Right. More and more. Now, I'm not saying, and not saying that has to be the case, but I tell you what, if you're at the end of your game and you have this pain, all of these modalities could really work.
Sure.
And we try to have them available. So our ideal here is to get you back as quickly as possible. How do we do that? So let's just recap, and we'll call this a day. First of all, you got to get to see me. That's the key. I can't help you unless you help yourself and give us a call.
And you can make an appointment today.
Yes.
Just by calling 732-269-1133. That's 732-269-1133. You can also go to JerseyShoreFootAndLegCenter.com, and you're going to find out everything that we've been talking about here on Scrubbing Up with Dr. Michael Kachmar.
Right. Now, so the first thing you got to do is contact us.
Yeah.
Then you got to come in for an appointment. Now, we have two offices, one in Barnegat in New Jersey and one in Bayville. The one in Barnegat is right off the Parkway. If you live up in Monmouth County, even if you live up in North Jersey or South Jersey, you get on the Parkway, you have a 45-minute, half hour, even an hour ride, and you're there in our office. We'll see you. We accept almost all insurances, and get in there, even if it's for a second opinion. Yeah. If say you're looking at surgery, you could try our this non-invasive stuff that is very helpful, and maybe you avert having a surgical intervention. Or if you're not getting better, come and see us.
Yeah.
And so now,
these locations are smack dab in the middle of thriving areas, where families are coming to settle. All these people are coming to settle, and you've got a super specialist like Dr. Kachmar here. Anything going on with your lower extremities, this man can take care of you.
Well, so you could get to us. That's number one. Then we need to get a diagnosis, and a right diagnosis. You may have been misdiagnosed. You may be being treated for something that's not actually the problem that you have. And I have the expertise, the training, the credentials, and the experience of almost 40 years to guide you through this. And I tell you right now, there isn't really much that I don't know. So, I'm usually not fooled, or we'll come up with a diagnosis. The next thing is that we got to get a diagnosis. So here's what you do, Jeremy. Think about it. You need a diagnosis, okay?
Yeah.
Diagnosis. Then you need a prognosis, and then a treatment plan. Now, so say you say, okay, the diagnosis. The diagnosis is plantar fasciitis, heel pain. What's the prognosis? Very good if you follow this, or very bad, but it's very good. So we have a good prognosis based on our experience. And what's the treatment options? Here they are. Cortisone injections, maybe, or the orthotics. Physical therapy in the office, heat, a red therapy, infrared therapy, ultrasound therapy, medical foods. We talked about it on our last show. People could archive that. That's an anti-inflammatory. There are topicals we could put on. We actually have a new product. Again, this is all new stuff. It's actually it's a small little apparatus. It's and what you do, it's got a battery in it, right? And then there's a cell, a battery. It's about the size of a cigarette lighter. What would be a matchbox, right?
Right.
And you put this on your area, and it's got a little battery in it, and then another well filled with steroid. And what it does is it pushes the steroid into the body. It's called phonophoresis or onophoresis. So the battery sets up a magnetic field because it needs electricity. It's almost like a ultrasound or a high voltage stim, but it's pushing the steroid into the body. It's another thing we could do. We also have topicals with CBD, or anti-inflammatories, lidocaine. Yeah. We actually do sometimes. It sounds crazy, but we use old technology. I love the hot wax. You actually. You can still buy them in a drugstore. It's a thing. It's wax. You heat it up and it melts it. And you see how when you take a vanilla cone, you dip it in a hot chocolate, it's the exact same thing. You dip it in, and then it hardens, you dip it in again, right?
Oh, yeah, okay.
You remember that from, well, that's what we do with the foot and the hand. It works great for some people. And you know what? That is cheap. I could buy, that we could do. And you got to be careful. You got good circulation. You don't want to burn anybody. And if some people are very sensitive, but I tell you what, that heat therapy works wonders. Okay. Yeah. So anyway, let's call it a day for today. Jeremy, just go. We want to thank everyone for tuning in. We got to get going here. Jeremy, you want to start? Give everybody.
Yeah. For more information about Dr. Michael Kachmar and all these wonderful things we're talking about, go to JerseyShoreFootAndLegCenter.com. If you want to make an appointment with Dr. Michael Kachmar, you can call us at
732.
Yeah, 269-1133. That's 732-269-1133. In the meantime, be kind to each other, and we love you.
Yep. Have a nice weekend. See you next week.
Take care, guys.